Hello, I'm Ramisha Anuradha De Silva. This is my presentation of Poverty in Contemporary in Britain, Access to Higher Education Diploma of Nursing at Learndirect. I discuss about an evaluation of absolute and relative definition of poverty. The different definitions of poverty, there are a lot of different definitions of poverty, including income poverty, absolute poverty, relative poverty, and social inclusions. I have discussed about absolute and poverty and relative poverty through my presentation. Next topic is poverty is a complex concept, and here are explanation of why we have different definition of poverty can become problematic. They become problematic as subjectively inequality and human rights. What problem population face due to poverty? There are a lot of problems in their daily life. Insufficient income for basic needs including food, shelter, clothes, medication, transport, and educations. So that government make a lot of policies place for as a results after analysis. Through this presentation I have discussed about this topic, and I discuss about next when evaluation of definition of poverty, how poverty definition can be useful in explaining poverty as well. How change the poverty in Britain through the old system, that there are a huge thing change in UK, that how poverty has changed, including poverty has changed for humanity through the history, and poverty was a common outcome in ancient societies due to factors such as limited resources, economic inequalities, lack of social safety, and actually changes in poverty occurred as the society developed due to factors such as industrialization, urbanization, economic system changes. There are a lot of changes I have discussed about this presentation. In the early 20th century, welfare program and social reform aimed to improve living conditions and elevate poverty among the marginalized, and poverty reduction was a global focus during the mid-20th century. In 2016-17, relative low income rates, including housing costs, have fallen from 22% and 18% for children, from 30% and 24%, and for pensioners from 10%, 16% and to 11%. And also the government introduced the Joseph Rowntree Foundation, and minimum wage also helped to ensure that workers are paid equally and fairly. The Equality Act 2010 and section of the Special Environmental Needs and Disability Act 2001 provide extended legal protection for disabled people in various areas, including employment. Food banks and charities help people who really need help, who are in poverty with finance problems. Child tax credit also helps children with rising costs, and it has been introduced the rate of child poverty, and it evaluated against family income. In 2017, the child tax credit support was limited, and it was only available for up to 2 children. Also, free school meals in UK are really helpful for children who are from low income family. That meal may be there only one meal with nutrition for all day. Also, the energy price has gone up after that Russia invasion of Ukraine, and the government also trying to sort these problems, and I have included this one as well. That's a lot of theory I have included through my presentation and discuss about those topics. And the overall level of poverty has been changed since conservative led government to power in 2010, and also after 2019-2023 coronavirus effective time, government escalated financial support for NHS to reduce spread of infections by supply PPE. According to NHS, England has increased readmission every year since 2001-2002 by around 2.6 service set up and all care sectors, including agencies, private hospitals, care providers are altogether improving delivery of good quality care by easily sharing health issues by updated the way care at home is provided. And also for last 25 years the NHS United Kingdom has gone through the significant changes in terms of funding. These changes have had a positive and negative significant impact on health sectors. Those theory I have discussed about that changes, how they change poverty through those years, past years, and I have included a lot of topics. Analysis of the different methods of measuring poverty. Charles Booth and Seaborn Roundtree, both wealthy businessmen who became involved in social researches. They reduced scientific methods into studies of poor, which enabled them to provide statistical data to affect the level of urban poverty. Social metric commission approaches, and there are a lot of other approaches like money metric measures, alternative measures, composite indices. Measuring poverty involves a mixed relative, absolute and multidimensional approaches. Each method provides unique insights into the complex issue of poverty in the UK. Then I have included analyzing poverty in the UK involve various methods, and here are some key approaches discussed about: relative low income, absolute low income, material deprivation, social metric. Then I have included how methods are applied for measure poverty and what kind of results come out as results. Results of methods of poverty. I have included relative low income, absolute low income, and according to the UK Poverty 2024 report by Joseph Rowntree Foundation, poverty levels 8.1 million working age adult, 4.2 million children, 2.1 million pensioners. There are future prospects. The report highlights the need for the plan with creative policies to end poverty in the UK. There are a lot of topics I have included through my presentations and very deep discussion of these subjects. The future remains deeply worrying, especially considering the impact of the pandemic and ongoing economic challenges. Poverty in the UK requires concerted effort, policy changes, and focus on vulnerable groups. Then I have included summary and recommendation. In this unit, I have discussed about evaluation of absolute relative definition of poverty and explanation of how poverty has changed in Britain and analysis of different methods of measuring poverty. And also I have included references and bibliography. Thank you so much for my presentations. Thank you.